Tara Willemsen is here with us today, and she is our operating room director. And I've asked Tara to come and explain to you what the donations are buying this year from Lend a Hand. And so we're right in the thick of our operating room revitalization. And it's always good, I think, for donors to get a first-hand look as to what your donations are supporting. And certainly, we want our surgeons to have the very best equipment. And even more so, I want our patients to have the very best equipment when they come for surgeries at the hospital. So I think we can all be very excited about this year's leg of the Lend a Hand campaign. And thanks, Tara, for educating a bit on the OR. All right.
So I'd like to start off by thanking Kelly and the Foundation for inviting me to get the opportunity to meet all of you here today. As Kelly said, I am an unfamiliar face, so I am the almost new perioperative director. I joined the team in January, and I'm very excited to be there. I wanted to share with you a little bit about my background. So I've always been an OR nurse. I'm very passionate about the operating room and the perioperative environment. When I graduated from nursing school, I ventured on down to the United States, as a lot of nurses do, and I spent some time down there. I worked a year in Texas. And then I went up to a larger institution, Johns Hopkins Hospital in Baltimore, Maryland. Some of you may have heard of that organization. And I spent 5 years there learning how to do cardiac surgery, but I did perform all surgical services while I was there. Once I gained that expertise, it allowed me to come back to Canada, where I was able to work just down the road in Kitchener at St. Mary's, and I was able to help them open up their cardiac program, and I was their OR educator there for the last 8 years. So in January, I came to Norfolk General, and one thing that I'm very proud to share with you today is that over my past 15 years of working in the OR, Norfolk General surgical program is on par with all the other hospitals that I've worked with in North America. So we may be small, but we are definitely mighty. So what does take place behind our closed doors? Because for any of you that have actually come and had surgery, hopefully you didn't remember being back there. So this is our team. We have 4 anesthetists, 5 surgeons, and 9 registered nurses. We perform surgery 24 hours a day, 7 days a week, 365 days a year to ensure that we're taking care of the community. We presently perform general, gynecological, obstetrical, ophthalmic, orthopedic, and urological procedures. But as we perform these surgeries year after year, our equipment does become dated, obsolete, and new technologies emerge. And that's why some of our equipment does need to be replaced. So this year, what are we asking for? Well, our present bronchoscope is 15 years old. And we use this piece of equipment to examine your airway and your lungs, and we're looking for abnormalities. So sometimes people come in with a foreign body in there. It could be used to look for inflammation or bleeding. For tumor, we use this device to assist us in performing biopsies. So we collect specimens, and it helps us provide diagnoses. So what that means is a patient would come in, they could be hypoxic, which means they have a low oxygen level, or they could be presenting with a chronic cough or shortness of breath. So that's when we would use this piece of equipment with you. So today's technology would help us provide a higher quality, higher resolution, which would allow for more accurate visualization. So for the team, that means better clarity and color. And also, if you notice the picture up in the top corner, only the surgeon can see through that scope. And then that just means he's seeing the image. The new technology today allows us to use a video, and that means that the entire team can see what he's seeing, so that helps us in providing care with him and anticipating each patient's needs. Next, we have our bassinet warmer. It's presently 26 years old. So we perform approximately 60 C-sections a year, and after the baby is born, while it's still in the operating room, a physician, a labor and delivery nurse, and a respiratory therapist assess the baby before it can leave the theater. And for any of you that aren't aware of how an OR works, we actually keep it very cold in there, and that's due to our sterility requirements. So for our newest members of the community, it's very important that we keep them cozy and warm. So a new warmer would allow us to provide built-in suction, oxygen, and more efficient radiant warming for the little people. All right, next we have our anesthesia monitors. Our present monitors were 13 years old, so we're currently replacing them. And we use these monitors to let us know what your heart and lungs are doing during surgery. The nature of surgery itself involves intense pain and requires muscle relaxation. So anesthesia administers large doses of medication, and just the invasiveness of the surgery itself creates or puts patients in a critical situation. So we want to know what you're doing at all times. So this new technology is going to allow us to do that better. Each anesthetist will have the ability to look at 2 monitors in color, and we're very excited about that. So once your surgery is over, you then go to the post-anesthetic care unit, or we call that PACU for short, which was known as the recovery room. And there again, we have to monitor you. We want to know what your heart rate, your blood pressure, your respiratory rate, and your temperature are doing. And that just helps us ensure that you're waking up from your surgery without any complications. So each year, lastly, I'd like to end on the fact that we perform approximately 2,500 surgeries per year. And if you could help us do the best work that we can do, we would greatly appreciate it. And thanks again for allowing me the opportunity to explain all this to you. I didn't know if anybody had any questions.